This is Adam Rosh from Roshcast, and I want to welcome you to another episode of The Reveal, where I will take you inside the mind of a test taker to deconstruct and connect the dots of a board-style question so you can become a better student, transform how you learn, and excel not only on high-stakes exams, but also in your general medical knowledge. So let's get started. We have an 8-year-old African-American girl with a history of sickle cell anemia who presents with diffuse pain consistent with an acute sickle cell pain crisis. While in the emergency department, she develops acute onset headache, right-sided facial droop, and right arm weakness. A CT scan confirms the diagnosis. Which of the following is the next best step in management? All right, so let's see what the reveal is here. We have a clinical presentation that is consistent with a stroke. We have right-sided facial droop, right arm weakness, and a headache. The key here is that this patient has sickle cell anemia. So let's look at our answer choices. I'm going to start with MRI of the brain. Ultimately, MRI of the brain will be required. However, we already have a CT scan that probably ruled out an acute hemorrhage. So MRI is only going to delay management, right? The question is asking for the next step in management. So MRI is not the best answer choice here. Tranexamic acid is an anti-fibrinolytic agent. So it's used in the management of hemorrhage, and we do not believe that we have hemorrhage at this point. So I am going to X that out as well. That leaves us with 2 answer choices here. Now, in the classic stroke patient, thrombotic stroke patient, most of the time in an exam like this, we're going to be choosing TPA or a thrombolytic, in this case, Alteplase. However, this patient has sickle cell disease, so Alteplase or thrombolytic agents are not the first-line agents in young patients, especially with sickle cell disease. So I am going to X that out. And that leaves us with exchange transfusion. That is the recommended management for stroke, acute stroke, non-hemorrhagic in sickle cell disease patients. And along with exchange transfusion, red blood cell transfusion is also very important in these cases to reduce the level of HBSS, the sickle cell red blood cell. So let's try B and see what we get here. Sure enough, answer choice B, exchange transfusion, is the answer here. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.